Hi, this is Katy. I'm going to be speaking to you about caring for your child living with type 1 diabetes, specifically from birth through age 12. I'd just like to give a general overview of what type 1 diabetes is. Everyone explains and understands this very technical disease a little differently. So starting out, type 1 diabetes is considered an autoimmune disease. This is because the body's immune system attacks its own pancreas, specifically the beta cells that are responsible for insulin production. So these patients completely stop making all insulin. And so in order to survive, they must have insulin delivered by injections or an insulin pump. There is also one inhalable insulin currently FDA approved for use. However, this is different from type 2 diabetes, which is much more common, as many patients living with type 2 diabetes still make their own insulin and don't need to have any additional insulin given to them. They can take oral medications or even modify their diet and lifestyle to have appropriate glucose control. Type 1 diabetes typically does strike in childhood, and accounts for 5 to 10% of all diagnosed cases of diabetes. So again, a small percentage overall, but can be much more severe and requires lifelong management. Just to discuss a couple of modifiable versus non-modifiable factors, type 1 diabetes is not preventable. There is no cure, and we don't know exactly what causes it. There are theories about environmental triggers and perhaps an exposure to a virus in childhood, but there's no pinpointable cause for type 1 diabetes. It differs from type 2 in that that's considered a lifestyle disease. A lot of people develop type 2 diabetes as a result of obesity or poor nutrition choices, a sedentary lifestyle. However, type 1 diabetes is not a lifestyle disease. It's also not transmittable or contagious. You can't catch type 1 diabetes from someone else. And it's also not as linked to hereditary and families as type 2 diabetes is. It is, however, a disease that can be successfully managed and dealt with lots of education and a great healthcare support team. And by doing so, you can prevent some of its potential complications. I'd like to talk about a couple of ways that type 1 diabetes impacts the body, just going through a number of body systems, starting with the heart. The American Diabetes Association uses an acronym called the ABCs of diabetes, A standing for A1C. This is a blood test that is typically drawn every 3 months to give a look back at what the blood sugars have been doing for the 3 months previous. It's kind of like a report card. And ideally, less than 7% is good control. For a child, 6.5 or below would be more appropriate. And that just basically gives parents and patients a good idea of how well their diabetes management has been. The B stands for blood pressure and the C for cholesterol. There's general guidelines that the American Diabetes Association follows for appropriate blood pressure ranges and healthy cholesterol numbers. These three components really tie into each other, especially as patients get older. A high blood sugar kind of can, the sugar molecules can rough up the vessel walls, making it more easier for plaques, cholesterols, fats to stick to the side of the blood vessel walls. And if those blood vessels are also constricted due to elevated blood pressure, it puts patients at a much higher risk for cardiac events and strokes. So not something that parents might think of, when they're dealing with a 7 or 8-year-old child, but something to be mindful of that, of how important good glucose control is in childhood and starting out to give these patients the best shot at a long and healthy life. Moving on to the lungs and the immune system, patients with diabetes are at an increased risk of opportunistic infections such as tuberculosis, and those living with diabetes are considered at risk, therefore more susceptible to contagious respiratory illnesses. The general guidelines is just to use good hand washing, basic skills that you're taught. Teach your child to wash their hands after using the restroom, and frequently throughout the day. Maybe as soon as they get home from school, washing their hands, as so many germs and colds are passed around the school setting. Also, vaccinating your children against many communicable diseases is a great idea to help prevent them from developing illnesses. And we'll talk a little bit later about why illnesses can become a very serious issue in a patient with type 1 diabetes, more so than a child living without type 1 diabetes. There can be serious complications from illnesses, so being preventive is really the best approach to preventing some of those complications. Moving on to the neurosensory aspect, neuropathy is a common complication of diabetes. Oftentimes this is one of the initial symptoms, numbness and tingling in the fingers or hands or feet. Is referred to as neuropathy. This is just pain of the nerves. They're very small, sensitive nerves that are susceptible. So if blood sugars are elevated, again, they're like little shards of glass that do nerve damage. The good news is as blood sugar is controlled for an extended period of time, the nerve tissue is actually regenerative. So some of this can resolve just with good glucose control. Retinopathy and blurred vision are also complications of high blood sugar. Having an eye exam, taking your child to have a full eye exam, not just the reading, covering one eye and reading the chart on the wall, but having their eyes dilated and looked at both internally and from a reading standpoint is really important to make sure that there's none of those visual complications developing. Many of them are easily treatable, but important nonetheless to identify, as they can have ramifications in learning and in school if they're not diagnosed and treated properly. The musculoskeletal system, obviously there's rapid growth that occurs from birth to age 12. Good nutrition is important for any child, but especially for these patients. They need as much quality nutrition as they can get to maintain healthy growth and to maintain good glucose control. If a patient is on steroids, broken bones become a big issue in childhood. If a patient is given steroids for an injury, a torn muscle, or any kind of those typical things that we see a lot of in children, steroids really drive up the blood sugar pretty dramatically. So if you have a child that is requiring steroids for any reason, even asthma, there's a lot of steroids used to manage asthma. Testing more often, making sure these patients stay really well hydrated and are getting the appropriate dosing of insulin based on the increase in their blood sugar is very important. Moving on to the GI or gastrointestinal system, children living with type 1 diabetes can have something called gastroparesis. Symptoms include a feeling of fullness, nausea, vomiting, abdominal pain, and bloating. These are common complaints in children, so this is something to look into to differentiate between just a typical stomach ache and something more serious like gastroparesis. It's just a slower emptying of the stomach. And diabetes actually accounts for almost 1/3 of all gastroparesis cases in children. So this is something that you see relatively frequently in these patients, and it can cause nutrient deficiencies, impaired glucose control, and frequent discomfort, which can be very disruptive to a child if they're having to deal with stomach pain frequently in the school setting. It makes it difficult to concentrate, and they can have some serious repercussions from that. The urinary system, polyuria, is a word that you will hear frequently. Most children, when they're diagnosed initially, have had some symptoms. Some people refer to it as the 3 Ps: polyuria, polydipsia, and polyphagia, so hunger and fatigue and extreme thirst and peeing more frequently. All of those things are classic symptoms of diabetes. So polyuria is just excessive urination. If you notice that your child is peeing way more frequently than what is normal, that's something you'd want to look into. It could be linked to both an elevated blood sugar. Hopefully you're testing and you would know that ahead of time that their blood sugars were elevated. But it can also be a sign of a UTI. And since sugar, glucose, all these words are interchangeable in the bloodstream, gets flushed out through the kidneys and the urinary system. That sugar just feeds bacteria. So these children can be at a higher risk of a UTI, especially in the female patients. So if your child is peeing more often and their blood sugar has been relatively normal for them and in range, it may be worth looking into with their pediatrician if they have any kind of urinary tract infection. We're going to move on to skin care, and primarily we're going to hit foot care. This is something that most people don't consider until, except for in elderly patients, but this is something that is very important even in the children to start this education, that they need to wear socks and shoes. We don't want to see them running around outside barefoot because diabetes can cause a difficulty in healing from infection, a decrease in sensation. All of those things can lead to some real complications if there is to be a wound in the foot. So we want to make sure they're wearing good, comfortable, loose-fitting socks and good quality shoes at all times. Make sure that you're inspecting the bottoms of their feet and keeping them moisturized, but not putting any lotion in between the toes, washing and drying them thoroughly. All those kind of basic foot care measures are important, and you just can't start that too soon. As for reproduction, I've kind of noted on here that there's no physical changes yet. Something that is a little bit of a difficult thing to consider and to think about in your children is the implications that high blood sugar can have later in life. Elevated blood sugar over time, can damage nerves and blood vessels, and the reproductive system is no exception to that damage. So men can have issues with fertility and erectile dysfunction, and women the same. Of a woman who is trying to get pregnant needs to have extremely tight blood sugar control. There's some serious complications for a woman with gestational diabetes or a type 1 diabetic. And her blood sugars in pregnancy, as those can lead to an enlarged size of the baby at birth and even stillborn. So something that you may not consider in your 4, 5, 6-year-old patient or child, but important nonetheless to consider. Just another motivator to make sure that that you're teaching and making sure you're monitoring so they have good glycemic control to prevent those multiple reproductive issues down the road. The endocrine system is, of course, affected. Diabetes is an endocrine disease. It affects the pancreas, which is an endocrine gland. These patients should seek the care of an endocrinologist. You wouldn't go to your dentist for eye care. Seeing an endocrinologist for your diabetes is highly encouraged, especially if your child is going to be utilizing an insulin pump. The resources and information that these specialists can give you are so valuable. It's really important to establish care with an endocrinologist if that is available where you live. In regards to fluids and electrolytes, fluid balance can be affected. So it is important to stay really well hydrated, especially when the blood sugar is elevated for different reasons. And we're going to touch on that a little bit more in a minute when we discuss DKA. But again, with more extreme situations with blood sugar control, you can see fluid status being both too much and too little. So being mindful of that, encouraging water, avoiding any sugary beverages, including pop, fruit juices, all of those types of things is really important. We're going to move on now to something called DKA, or diabetic ketoacidosis. I'm bringing this into the discussion because it's the most serious hyperglycemic emergency in patients with type 1 diabetes, and it is associated with significant morbidity and mortality. So I think it's very important to always take the opportunity to discuss this. Most of the diabetes-related morbidity and mortality in childhood of type 1 diabetics can be attributed to complications of DKA. So what DKA is basically when there's not enough insulin in the body. Either maybe your child is missing a dose, or they have greater insulin needs than what is being provided. The body is not able to use the sugar in the bloodstream for fuel, and so it begins to break down fat. These patients can lose a lot of weight really quickly. And when fat is broken down, it releases acids, and that, the body has a very narrow tolerance for blood sugar ranges, and it has an even more narrow tolerance for acid-base balance in the blood. It does not want to have any kind of an acidotic environment. So they can become very sick very quickly. Causes of this: stress. Any type of stress on the body can elevate the blood sugars, both from illness, physical stress, surgery, to even emotional stress. A lot of times parents disregard the level of stress that a child can experience, in social settings or family struggles, but it can definitely have a high impact on the blood sugar, so it's something to be aware of. I mentioned illness and insufficient insulin. If a patient has, for example, an asthma attack and is requiring some steroids, their blood sugars are going to be much more elevated than normal. And if we aren't compensating by giving them additional insulin per their endocrinologist guidelines, then they can run into a situation like this where their body begins to break fat down for that fuel, and that acid gets released. Signs of DKA. These patients really present very sick. This isn't something that is going to get missed, but some of the symptoms are nausea, vomiting, and abdominal pain. Again, that could, not necessarily trigger in your mind anything, as kids frequently have, stomach aches and things like that. There's a very distinct smell to their breath. It's because of the acetone. Once you smell that smell once, you will never forget it. It's pretty unmistakable, but it does have a sweeter, fruity smell. Obviously, high blood sugars. If a patient is in DKA or going into DKA, they're going to have higher than normal blood sugars. And something called ketones, positive ketones in the urine. If you have a child with type 1 diabetes, you should always have something called keto sticks in the home. You can purchase them over the counter at Target or Walgreens for about $20 for 50 of them. So it's an inexpensive but really important tool. If you have any question about, is my child perhaps breaking down fat for energy? Are they about to transition into this diabetic ketoacidotic state? You can have them urinate on one of these little strips that's shown in the picture, and it gives a coding, and there's trace ketones, moderate to high levels. If a child is presenting, if they use their keto sticks and there's any amount of ketones in the urine, that would be a great cause for concern, and you'd want to seek medical attention immediately. Increased thirst, urinating more frequently. In severe cases of diabetic ketoacidosis, you will have rapid shallow breathing, or something called Kussmaul's, that may not necessarily be something you would notice, but by that point they're probably pretty ill and they should have some other symptoms showing as well. Also, in severe cases, they may present with low blood sugar and altered mental status, confusion, just kind of saying things maybe a little bit disoriented or sleepier than you would expect. So again, this is a pretty dramatic presentation. This isn't something that will get missed, but it can happen quickly. I've seen type 1 diabetic children transition from normal blood sugars and everything fine. They miss they miss a day's worth of insulin. They didn't get to the family didn't get to the pharmacy, or perhaps the child was had a stomach illness and was not eating or drinking and not keeping anything down, any fluids, so they didn't give the insulin that they're ordered to give, and so their blood sugars were really high, and families can assume that if there's no food that their blood sugar won't go up, but that's not the case. So no insulin, and within a day or two they've kind of transitioned into this acidotic state. So it's something that can come on very quickly. The treatment for DKA, it is an emergency situation. You need to seek emergency medical attention, go to the nearest ER. You'll likely need an insulin drip via an IV pump, and lots of extra fluids and monitoring to make sure that they can come out of this with as few or any complications as possible. It's important to always evaluate what led to the DKA event. So sometimes, most of the time it's not a fault of the patient or the parent. This happens, with, as we mentioned, just illness. If a child is, again, has a stomach bug, which children frequently get, they may find themselves in this situation, and that's of course no one's fault. But then allowing time to rest and recover. I've had patients say they felt like they got hit by a bus, even when their blood sugars are in control, their anion gap is closed. On paper and from a lab standpoint, they look great. They really feel pretty worn out. This does a number on the body, and so it's important to let these patients really take time to rest and recover. And again, just evaluating what led to it. What can we do different, if anything, to make sure that we don't have this again? So if you know your child is going to be taking steroids, setting up a plan ahead of time with their endocrinologist to address, their additional insulin needs is a great way to be prepared and to plan ahead. So we've talked about a lot of the kind of downers of diabetes and why this is so important to manage. It all comes down to the blood sugar, making sure that your blood sugar is in a healthy range, that your doctor, monitors and decides for you. But the American Association of Diabetes Educators has what's called the AADE7, and it's just the 7 general guidelines that they recommend to follow for good glucose management over the lifespan. And so they're all listed here. Healthy eating, carbs, of course, are those foods that break down into sugar. They have the most dramatic effect on your blood sugar. So learning how to properly proportion your meals with an appropriate serving of carbohydrates is very important. Something that is crucial for these families as a whole unit to learn. Appropriate carb counting. A lot of patients dose their insulin off of how many carbohydrates they're eating at each meal. So this is a very extensive process and ongoing. It's recommended that a patient has 2 hours or more of dietary, a meeting with a dietitian every year, just to stay on top of research and recommendations, as well as just to check in and see, here's what I'm doing, here's when my blood sugar really runs high, what can I modify to address that. So that's a whole other facet in itself. Being active, for children, it's a lot easier than adults. It's recommended that a patient with diabetes gets at least 150 minutes of deliberate physical activity a week. So that breaks down into 5 30-minute sessions. But hopefully, these children are just as active and energetic and involved in different activities and sports as any other child, as they should be, to get that exercise in, no problem. Monitoring is really the best way. The best tool you have to know if what you and your child are doing is working. Testing the blood sugar at least 4 times a day is really important. And an initial diagnosis, if anyone's in the beginning of this process, you will be testing your child's blood sugar, up to 12 times, even overnight, just so that we can learn when they run high, when they go low, all those different things to keep them safe. But moving forward, after you're a couple years in and it feels like old hat, always continue to check the blood sugar. There's no other way to know if what you're doing is really effective. Taking your medication, for these patients, again, they're going to require insulin via a pump or multiple daily injections, and never missing a dose of insulin, and following your endocrinologist guidelines for that is absolutely crucial. Problem solving and reducing risks, as well as healthy coping. These are why it's so important to have a good healthcare team behind you and your loved one that's dealing with this. Even in the smallest of children, establishing that good support group early with your healthcare team, having an endocrinologist and nurses and good staff and support, as well as an educator, is really important. This is a chronic and progressive illness. This isn't something that's easier to be taken lightly. So, of course, all the emotional components are really important to address as well. Technological interventions. Obviously, most people know the word diabetes. They've heard of the Juvenile Diabetes Research Fund and have probably, seen the different walks and fundraisers. This is something that gets a lot of attention, and thankfully so, because that money is really being utilized every day to find a cure for this disease. One of the newer research kind of possibilities involves gene therapy to stop what's called glucagon production. Glucagon is stored in the liver, a totally different organ than what we've discussed so far. But the theory being, if we can stop glucagon production, you might have just inherent good glucose control with or without the insulin production piece. Also, pancreatic transplants are happening. Stem cell research to figure out why in some why some people have this attacking of their own pancreas and beta cells, and subsequently needing insulin injections, for their lifetime. Insulin pump advances is really miraculous. The picture on the screen is something called an Omnipod. If you're familiar at all with insulin pumps, you'll know that there's a wire attached from the device that is inserted, the small catheter that sits under your skin, to the actual pump or computer, the brain of what's delivering the insulin. But the Omnipod is a newer insulin pump option that is wireless. So that white piece attaches to the skin, gets changed about every 3 days, and they can wirelessly direct the pump to give insulin. So that's something that's really exciting for a kid that's busy and in sports. They don't want to have this cord, kind of tethering their life, if you will, but this is something that is really exciting. There's also an Animus pump that's waterproof, which is a big important piece for children. They want to be in the pool. They want to be able to do all the things that their friends are doing in the summer and not have to worry about disconnecting their insulin pump and then having blood sugar issues. So that's a good opportunity advancement for them as well. Continuous glucose monitors are really something that have given a lot of parents peace of mind. If you have a child that tends to dip down into a dangerously low zone for their blood glucose, these have set alarms that will trigger and go off, and they're pretty loud, to wake you up and alert you to this, so your child doesn't sleep through this and go into possibly a coma or more of an emergency situation. And it also will alarm if their blood sugar is too high. You still have to test your blood sugar using a typical meter just to make sure these are not 100% accurate. And so it doesn't necessarily stop that, but it does give you a little bit of a safeguard if you have a child, as most type 1s are, where they have hypoglycemic events pretty frequently. So finally, managing type 1 diabetes in your child, it can be tough, and it is a lot of work and education, and it's definitely a lifestyle adjustment and a lifelong process, but it is not impossible. And I wish you all the best of luck with your disease management for your child.